Hi, I'm Karen Greenside. I'm a genetic counselor and executive director of the J-Screen program at Emory University. It's Fragile X Awareness Month, and I'm here with Gail Hyman to talk about Fragile X, how it impacts families, and the importance of genetic testing. Hi, Gail.
Hi, Karen. Thanks for inviting me.
Gail, tell us a little bit about yourself and your interest in Fragile X and how you've gotten involved in the Fragile X community.
I got involved in Fragile X when our middle child, Scott, got diagnosed with Fragile X. And our family has taken a huge role to get involved in organizations that work with Fragile X and helping for resources and information for families.
Right. So I wanted to talk a little bit about Fragile X syndrome and some of the symptoms. So Fragile X syndrome is a genetic condition. It causes intellectual disability, behavioral and learning challenges, and sometimes some specific physical characteristics. I think interestingly, and a lot of people talk about this, Fragile X is sometimes associated with autism. In fact, the majority of people with Fragile X syndrome also have either autism or they might be on the autism spectrum. And about 5% of people with autism happen to have a mutation in the Fragile X gene. In fact, Fragile X is the most common single gene form of autism. A lot of people don't realize that. So Gail, a little bit more about your story and Scott's diagnosis and really how Fragile X has impacted you and other members of your family.
Well, whenever you have a child that's not developing normally, it starts raising red flags. So Scott's first red flag was speech. He was at 4.5. He was not having full language. He only actually limited to a few words. And so we went to a developmental pediatrician who had no idea that Scott had Fragile X. There was no developmental disabilities or delays in our family at that time. When we got a diagnosis, we realized this was genetic and it might impact not just our son Scott, but other members of the family. And sure enough, I have two nephews that have Fragile X syndrome. And then in our family, there are 4 girls that are carriers of the premutation for Fragile X. So it does impact a family. Even as young children, they don't necessarily take on language and numbers and colors and walking and talking and all the things that other kids do naturally. So to get a diagnosis is kind of scary because you keep thinking you'll be able to fix it with the right glasses or hearing aids or teacher or something. And then the advantage of getting the diagnosis and what can be celebrated is that then you have a ton of resources and a community. So it was important for my sister and I to create a community of people where we could actually share ideas, even on how to get a haircut without, a big issue, or how to navigate the school system, or how to live independently with support. So having a diagnosis for us has been really good. And you mentioned autism. Autism is important because there are a lot of behavioral characteristics with autism. And there are autistic-like characteristics of many boys and girls with Fragile X.
So a lot of people get confused about Fragile X inheritance. You talked about carriers in the family and people who are affected in the family. So what are the genetics? Fragile X syndrome is caused by mutation or change in a single gene called the FMR1 gene on the X chromosome. And even though Fragile X occurs in both men and women, males are more frequently affected than females, and generally with greater severity. And this is related to the fact that females have 2 X chromosomes when males have only 1. If there's a mutation on the FMR1 gene, it involves an abnormal expansion of the DNA in a certain part of the gene. If there's a big expansion, the person has Fragile X syndrome. But if the expansion is of a certain size but not as big, the person is said to carry what's called a premutation, as you mentioned. So a person with a premutation may be at risk to have a child with Fragile X syndrome and they may be at personal risk for fertility issues or neurologic problems later in life. And so when there's a family with Fragile X, we're not only thinking about individuals who have Fragile X syndrome with intellectual disability, but also individuals who may have some personal health issues that it would be good to be aware of.
Absolutely. It's a family related disorder. Originally, they only knew it as a gene that affected developmental disabilities. And later, they have discovered that this same gene, when you're a carrier, such I'm a carrier, can cause related problems. So, an example, one related problem that's commonly known amongst Fragile X female women is fertility issues, miscarriages more than the average, and even something called Fragile X primary ovarian insufficiency, which is early in menopause. Mm-hmm. And then if you're a male or female in your 50s or 60s, and you're, again, a carrier for Fragile X, you're at risk for something called FXTAS, and that's Fragile X tremor ataxia syndrome. And it looks like Parkinson's and dementia. So even carriers are at risk for related disorders. And so therefore, if a family is carrying the gene, it's important for them to know what their risks are.
Absolutely. And that just leads us to a discussion about why carrier testing is important, what it is and why it's important. So if someone has a family history of Fragile X syndrome or associated symptoms, carrier testing can be done on that person to determine whether they have a premutation. Carrier testing for Fragile X is also available to anyone planning to have kids, regardless of their family history. Because it's important to know that most people who carry permutations were previously unaware of their risk. So if we were only testing people that we knew had a family history of Fragile X or these types of symptoms in the family, we would end up missing the majority of carriers or of permutations for Fragile X, who then wouldn't know the risk to themselves, to their kids, or to other family members. So really, Gail, over time, a lot has happened in the area of Fragile X. A lot of new treatments are available now. There's a lot of research going on. Can you give us just a little bit of an overview of where we are now, where things are going, and kind of the future of Fragile X treatment and care?
Absolutely. As it relates to testing, you are correct. A lot of people do not even know they're carrying the expanded gene, which creates premutation, or the fully expanded gene, which is full mutation. And I know for the audience, it's very confusing, but premutation, usually you carry the gene, but you don't have a lot of symptoms. You may have some, but they usually don't involve developmental disabilities. But the symptoms may include anxiety, depression, weight gain, things that you would never relate to be, you wouldn't be thinking about Fragile X. In my situation, I had no idea I was a carrier. And had there been J-screen and Fragile X carrier testing, I would have known in advance what my risks were. Every pregnancy for a female carrier is 50%. It's that high of having a child with Fragile X. It's not just having a child with Fragile X to consider, but it's the family-related disorders that I had mentioned, the primary ovarian insufficiency, as well as the tremor ataxia syndrome. So for me, being aware of your genetics is first and foremost most important. And then you can, work with a genetic counselor as to choices. The research for Fragile X continues. The National Institute of Health and CDC have put a lot of money into grants for Fragile X. It's a gene that impacts the brain, as we talked about developmental disabilities. So even with dementia, Alzheimer's, and other brain disorders, they like studying the Fragile X gene because there's actually a gene to study. Mm-hmm. In terms of reproductive sciences, the fields of endocrinology and gynecology take a huge interest in Fragile X because, again, it's a gene to study. So maybe they can understand what it is that causes women at times to have reproductive issues. So there is no cure for Fragile X. The treatment right now, if you have a child with Fragile X full mutation, is early intervention with different therapies, including speech therapy, occupational therapy, and physical therapy. If you are a pre-mutation carrier and you're having issues with either the anxiety, the depression, the early menopause, you should seek help with a doctor to treat the symptoms because there is no cure. If you have early signs of Parkinson's or dementia in your 50s or 60s, you see a neurologist, but the same medicines that work for Parkinson's are ineffective for Fragile X tremor ataxia syndrome. And it also leads to early death. So these are things that families should know about Fragile X and know that we're on the cusp of a lot of new research. And within the next 5 years, I do believe there could even be a cure. But as of right now, you treat symptoms.
Thank you. So for people who are interested in carrier screening, you mentioned our J-Screen program. So J-Screen is a national program. It's based out of Emory University School of Medicine's genetics department, and it offers at-home carrier screening for not only Fragile X, but also hundreds of other genetic diseases, along with telehealth genetic counseling services. So the program really has a mission of getting carrier screening out to people across the U.S. to make it accessible, to make it affordable, so that people get information that they can use to plan ahead for the health of their future family. If anyone's interested in learning more and getting tested, they can visit our website at jscreen.org. It was such a pleasure to talk to you, Gail. I'm so glad we had an opportunity to catch up and talk about Fragile X during Fragile X Awareness Month. It was great to see you.
Thank you, Karen, and thanks for all that you're doing for families with that know they have Fragile X and families that don't even know it's in their gene.
Thank you, Gail. Bye.